Hello, welcome to my student support system. In today's class, we will discuss about fever and its management. This lecture is in English, and if you want to study in Hindi, just click on I button and you will get link of Hindi lecture. Or you can directly visit to my channel, my student support system. What is fever? Fever is also known as pyrexia. It is defined as a rise in body temperature above 98.6 degree Fahrenheit. Fever is not a disease, but it is a sign. Fever is protective function of our body as rise in temperature prevents growth of pathogens. And it also shows us that there is something abnormal in our body. So this is an indication. What are the causes of fever? A lot of causes are there. Mainly fever is caused by inflammatory process of any infection, surgical trauma, heat stroke from exposure to hot weather, allergic reactions to the foreign proteins, etc. Especially when we give some vaccines because it is a foreign protein. What are the types of fever? We should know what are the terms which we use for different type of conditions in the fever. Fever or pyrexia is classified in many types depending upon the pattern and the level of temperature. First is onset. Onset means onset of fever or invasion of fever is the time period when the body temperature starts rising and is increasing continuously. So this is known as onset of fever. Then fastigium. Fastigium or stadium of fever is a stage where body temperature reaches to the maximum and in a particular fever episode and remains constant at high level, then this condition is known as fastigium. Decline. Decline of fever is a stage when the body temperature starts declining and reaches to normal. Then this is decline. Crisis. What is crisis? When the body temperature returns to normal suddenly, then it is known as crisis. There are two types of crisis related to fever. One is true crisis. When the body temperature returns to normal suddenly with improvement in the patient's general condition, it is known as true crisis. But when the body temperature returns to normal suddenly without improvement in patient's general condition, it is known as false crisis. Lysis. When the body temperature returns to normal slowly in zigzag manner, means sometimes it is low, then high, then low, then high, and then finally in 2 to 3 days it subsides and become normal. Then it is known as lysis. Constant fever. When the body temperature fluctuates not more than 2 degree Fahrenheit between morning and evening time, but it does not return to normal, then it is known as constant fever. Remittent. What is remittent fever? When the body temperature fluctuates more than 2 degree between morning and evening and does not return to normal, then it is known as remittent fever. It is written here wrong. It is actually a remittent fever. Intermittent fever. When the body temperature rises from normal to high and back to normal at regular interval, then it is known as intermittent fever. Inverse fever. When the body temperature is highest in the morning and lowest in the evening, then it is known as inverse fever. Then hectic fever. What is hectic fever? When the difference between high and low points of body temperature in a day is very high, means the difference is more, then it is called hectic fever. Relapsing fever. When the body temperature becomes normal for 2 to 3 days but then suddenly increases again, then it is known as relapsing fever. Low pyrexia. When the body temperature does not rise up to 100 Fahrenheit, means above 100 Fahrenheit, then it is called low pyrexia. Then moderate pyrexia. When the body temperature remains between 100 to 103 degree Fahrenheit, then it is known as moderate pyrexia. And when the body temperature is between 103 to 105 degree Fahrenheit, then it is called hyperpyrexia. Next term is hyperpyrexia. When the body temperature rises above 105 degree Fahrenheit, then we call it hyperpyrexia or hyperthermia. And what is hypothermia? When the body temperature falls below 95 degree Fahrenheit, then it is called hypothermia. So these are the different types of fevers. Now we come to management of fever. Many times in our family, we find a family member suffering from fever. What should we do? What can be done in the home as well as in the hospital? Approximately the basic management are same, be it in the hospital or in the community at home. First of all, the body temperature should be checked and recorded in the patient's record. Whenever we find the increased temperature, we should check and record, and then we start further procedures. In case of low pyrexia, what is low pyrexia? We just have studied below 100. Then the room temperature adjustment only needed. The room should be well ventilated. Electric fans can be switched on for ventilation. Cool drinks may be given to the patient and apply cold compress or ice packs to reduce body temperature. Hypothermic blankets or mattresses may be used, and if these activities cannot lower the temperature, then antipyretics drugs can be administered on physician's order. Provide plenty of fluid to increase hydration of the client, because in fever, fluid loss is there. The patient is encouraged to visit the physician as soon as we find any fever patient. Then we should think what underlying cause may be there, and to find out, to diagnose, the client should visit physician. We should encourage that you must visit a doctor. Or if the client is already in the hospital, then we should inform to the physician, and TPR charting should be done. Means temperature, pulse, and respiration should be recorded in patient's TPR chart. Then provide soft diet to maintain nutrition and easily digestible diet. To ensure adequate rest and sleep, maintain a calm and quiet environment near the patient. Help the client to change position frequently to prevent skin breakdown. Ask the patient to wear cotton garments if possible, as these cotton garments will absorb the sweat and enhance comfort. Sweat, SWEAT, here there is spelling mistake, you can correct it. Encourage the client for oral hygiene to prevent dryness of the mouth and lips. Apply After oral hygiene, apply emollients and creams on the lips to prevent any cracks. Sponge bath is given daily to keep the patient clean and fresh. Never leave the patient with high fever alone because rigor and convulsion may start at any time. Try to reduce body temperature by more frequent cold sponging because continuous high fever may damage the brain cells. If shivering or rigor starts, cover the client with blanket and apply warmth using hot water bottle. Warm drinks should be given to the patient because patient may feel cold. Provide safety to the client during shivering so that he is not falling from the bed. We should prevent him from falling from the bed. Soon after shivering stops, then patient may feel again hot and temperature may become very high. Then remove the blanket and provide a thin blanket. Cold compression is again started, especially on the forehead, to relieve congestion and headache at this stage. Temperature is carefully monitored every 15 minutes till it comes normal. Patient may have sweating after rigor, so provide clean clothes to the patient to help him to keep the skin dry. Thank you students for watching such important or knowledgeable videos. You just subscribe my channel. You can like Facebook page. For making your notes, visit my blogger mynursingstudents.blogspot.com. You can follow me on Twitter, Instagram and join Facebook group Nursing Notes. Thank you. Have a nice day.